Vytenis, Andriukaitis, how will the European healthcare market, when you leave, than it is right now?
We must see about possibilities to integrate, to see more solidarity, because distance in living standards it's huge. We must create networks of possibility to cooperate, to ensure that the European Union is ready to create better conditions to access to health care.
Maggie, the Benelux Pact that you mentioned, what is the latest on that?
The pact is not only negotiating together, but also the exchange of data between the countries, sharing registries, and also coordinating assessment methods. And so now we are starting also to negotiate for first time with a pharmaceutical company. It would be important to have a first success with Belgium, Netherlands and Luxembourg, and then we can see how we grow.
Mr. Kopernicky, why do we have to look at the way we approve medicines now, and why do we have to change it?
The conventional pathways, they were designed with the endpoint in mind being marketing authorization. They were certainly not designed with the endpoint being bringing a treatment or a medicine at a timely time point to a patient. We should understand adaptive pathways or adaptive licensing as bringing more efficiency into the process of developing or licensing medicine, certainly without decreasing their informativeness or without compromising the benefit-risk profile.
We know that the current model is far from optimal. Nonetheless, in comparison to what is being proposed, again, we are very concerned. Adaptive pathways is something far more than early access. We focus on profitable niches and we forget about the general patient population. We don't want to reach a level or a point where every disease becomes a rare disease. And one of the questions would be that you shift the burden of proof from the pre-entry phase to the post-marketing phase. Before we proceed with this kind of changes, initiatives, ideas, let's also look at what we have already.
One thing I can say very clearly, the conditions for market authorization will not change. So I think there is a pretty good hope that we'll manage to have a faster path towards authorization, but we're not going to soften the rules and the balance between benefit and risk, which is at the end of the day what you're looking at.
Mr. Harousseau.
I wonder if you'd start by perhaps giving us an idea of how you consider a fair price for a drug might be fixed.
Fair price means affordable price for a valuable drug. And the question is, how do you define the value-based pricing? Because countries have, of course, different economical resources. So the value of a given drug may vary across countries.
If we have better system in Europe where the price would be based on the value, would be tailored to the local specifics, then I'm sure the industry would have better business opportunities, and actually at the end it will be much more profitable and they will be able to have much more revenue on what they're trying to do and invest in new technologies and in innovation in the future rather than now.
Different patients are molecular profiling in different manners and should be treated in a different manner. If we could put those patients that would respond well to the existing drugs and only treat them and do other things with the other patients, that would save healthcare dollars in a huge way. And that is a model, that's the model for precision medicine or personalized medicine or whatever you like to call it.
Until now, the last 10-15 years, overall expenditure of medicines in Europe has been flat. And that's thanks to very effective policies of promoting generics, which we should use as often as we can. Okay? Thanks to that, effective patent expirations, we've been able to increase volume of medicine consumption 25% in Europe in the 12-year period, and cost flat. And what's really outstanding now, where there's a need for help, is horizon scanning, preparedness, technology horizon scanning, and govern jointly, some degree of transparency of pricing, not price points maybe, or price levels, certainly not net prices, but how do we arrive at these price proposals? Industry should be more transparent about pipelines and its reasoning.